So when you piece together a treatment plan, and usually patient perhaps walk into your office already have some imaging, and so let's start that process. So let's say you got the imaging work, you notice, you saw this is proven stage 4 disease. And what is the first line of treatment? How do you make this decision between, let's say, immunotherapy versus targeted therapy, let's say?
Yeah, that's a great question. And it's one that we've sort of debated now for years. But we actually have some nice clarity,
Sure.
thanks to some nice data that has come out. And of course, for our audience, you're, referring to that we know that, approximately half of patients with melanoma, their tumors have an activating mutation in BRAF. And we're fortunate to have very good therapies that can really effectively target that gene and have demonstrated benefit for those patients. On the other hand, we also have great advances in immunotherapies. I kind of collectively call them checkpoint inhibitors, and we have a few different flavors of those. But we were really, for a while kind of debating, let's say you come in, we have your scans, we know that we have a biopsy that's showing melanoma, and maybe we even have the molecular genetic testing back that shows that there's a BRAF mutation. We weren't so sure which therapy, would be best to start with. And I think we now have pretty, convincing data from the DREAMseq trial that sequenced targeted therapy followed by immune therapy with checkpoint inhibitors with IPI and Nivo. I'll just use the short names we
Yeah,
use,
yeah, yeah, definitely.
followed by the reverse order. And it showed that the patients who started with IPI Nivo did better, that more of them were alive at 2 years compared to patients that got the reverse order. And so we really, kind of underscores our feeling that, first line therapy for most patients, and it's not all, but most patients, really should be immune therapy based, in my opinion. Which immune
Well, we're
therapy,
gonna get into that. We're gonna
which
get into
combination,
that.
yeah, that's the different conversation. But I think, for most folks, immune therapy really represents the possibility of durable control.
So again, I think for our audience out there, this is a discussion, and for specifics, you really have to basically sort of go see your own doctor, your own medical oncologist, just
Absolutely.
because they're the one who really knows your specific conditions really well to figure out. Again, your point is absolutely right on. That is, for most patients, immunotherapy seems to be the first line. And